Hello everyone, welcome to Talk Here with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, today we are going to be talking about a very important organ in the body within the head and neck, the tooth. Yes. When you smile and your teeth are white, it makes you proud. And when your oral health, is healthy, you have good oral health hygiene, it also lifts your confidence. So on the program today, periodically we always talk about a part of the body and generally some health conditions that get to affect it. So I have a registered dental technologist who is joining me today, and we're going to start from talking about the anatomy of the tooth, as well as things that could lead to the loss of the tooth or even teeth, So, and also things that could be done to restore lost tooth or teeth, and as well as how we can take very good care of our mouth, as well as all the organs, especially the tooth. So, that's what we're going to be talking about today, and I know you can't wait. We'll go to video wall, and let me warn ahead, we might project some images of the teeth that is not very pleasant to look at, but we are going to show them anyway for educational purposes, because some persons who have challenges with their teeth might find out that, that their teeth can get that bad, so. Do stay with us. We'll be right back after this break. Welcome back to Talk Here with Dr. Laz, your favorite health program on television. We're talking about the tooth and how we can take care of it, and also the causes and replacement of tooth loss. And with me in the studio here is Victor Oge. You're welcome to the program, Victor.
Thank you, sir. Thank you for having me.
All right. Victor Oge is a registered dental technologist and oral health advocate, as well as the founder, Salt Hills Dental Care Foundation. And he already has the giant teeth there. Victor, let's begin from there. Kindly tell us about this, the anatomy of the teeth, before we get to the video wall to have a deeper conversation around this. So you could use the model to talk about it. What do we need to know about the normal dentition, right? That's why you came with this.
Thank you very much. Before I go into this, I have to appreciate you for the good works you are doing.
Thank you so much.
There are so many things that you have done that is making Nigeria great.
Thank you.
And if we have up to 50 persons like you who are taking the effort, who are making the effort you are making it in Nigeria, I'm optimistic that Nigeria would have moved from where we are now.
We have thousands that are doing very great things.
I am.
So let's get to the
okay.
The
so
Thanks for your kind words.
This is the mouth. Thank you. This is the mouth, the tongue. These are the teeth. We have the central incisors on the upper, the laterals, the canine. We have the 2 premolars.
Okay.
And we have the 3 molars.
Okay.
We have all this at the up and the same down.
Okay.
So they work together. They have different functions.
Okay.
But
so we'll get to speak a bit more about that. Okay. And when we get to the video, we'll project a tooth so that we can also look at the various segments, the enamel, the dentin, the pulp, and all of that. So, but now just refreshing our memory, for those who did biology in school, the milk teeth, the permanent teeth, so can you just refresh our memory from what period to what period do you have the milk teeth? When does it become the permanent tooth? When does the tooth formation stop, and all of that?
Okay, thank you very much for this. We have the milk teeth that grows from the age of 6 months.
Okay.
So from the age of 6 months, under normal circumstances, the first incisor, the central incisor at the lower should erupt.
Okay.
The second one follows.
Okay.
So both of them sometimes comes together. And then after that, the two centrals at the upper follows. So before you know it, the laterals will come.
Okay.
So the milk teeth will come, and they are supposed to exfoliate from the age of 5 years. From the age
By
of 5
exfoliation,
years,
you mean when they begin to
when
fall?
they begin to give chance
give
for
space,
the
okay,
permanent
for
ones
permanent
to
ones, okay.
come. And it's important the milk ones fall off at the appropriate time,
Okay.
so that the permanent ones will have a good place to stay at the appropriate time also. So if it doesn't fall off on time, it could also affect the position of the permanent ones.
Okay.
So, but under normal circumstances, before the age of 20, or from age of 20, all the teeth should be complete. And we have the 32 of the permanent ones, both the upper and the lower.
Okay, so you have 32, and by age 20, everything is complete.
It should be complete.
Okay, but for some persons, it might not. When does the wisdom teeth come?
The wisdom teeth come from the age of 18 and above.
Okay.
Some people, even at the age of 25, the wisdom teeth is still coming up.
All right, thank you. We're going to continue this conversation. After this break, you will go to the video wall and project some images and have the back conversation about tooth losses, causes, replacements, and the general oral care. Do stay with us. We'll be right back again. Welcome back to Talking Health with DrLaz, your favorite health program on television. Yes, we'll be talking about the tooth, causes of tooth loss, as well as replacement and other things you need to know about oral health hygiene. And Victor Ogay, a registered dental technologist, is here with me to have this conversation. Yes, let's quickly get to the video wall, and yes, that's the topic we're discussing. Let's get to the next slide. The anatomy of the teeth, Victor had already talked about it while we were sitting, and this is essentially the various parts of the teeth, just for you to refresh your knowledge of biology in case you've forgotten. 32, and like Victor mentioned, at age 20, it's expected that all the teeth should have been formed in most of the cases, except if there are some challenges. Let's go to the next slide. Yes, this is a single tooth. So Victor, you may take it off from here.
Okay, yeah. This is a single tooth, and we have the enamel at the top.
Okay, that's the whitish part, right?
Yes, that's the whitish part, and that's the first layer.
Okay.
So after the enamel, we get to the dentine.
Okay.
This is the dentine, the second layer, then the pulp. So these are the layers.
Okay, so here is where these are like nerves.
Yes, yeah, that's the pulp. That's
the pulp. That's the living part.
That's the engine of the tooth.
Okay, do you have blood vessels here as well? This looks
yes,
like
we have the blood vessels,
neurons and blood vessels.
Yes.
Okay.
I usually tell people that the tooth eats. It doesn't just masticate the food and send down. It's not an error. It eats from the food.
Okay.
It chews.
Okay.
So it benefits through the pulp.
Okay.
So when the pulp is exposed, maybe because the enamel is off,
right?
There could be a sensitivity and all that. So one might begin to have all that, and if a proper care is not taken, the person will lose the tooth.
Okay, so what you're saying essentially is this the hardest part, the whitish part that we get to see.
Yes.
So, and this where you have blood vessels, the nerves that also nourish the tooth.
Yes,
so if this place and this place is out and here is exposed, that's those, you take cold water or something, you have some sensitivity.
Not only just cold water.
Or anything at all.
Even air penetrating the nerve, the pulp could cause severe pain, and from there, the tooth could be lost.
Okay, so let's get to the next slide quickly with that background. So these tooth losses, what could cause this? Can you speak to these images? Maybe starting from this.
Yeah, this is a complication. Actually, there is a bone loss here, And you could see there is a caries. You can see those teeth are carious teeth. So the mouth is so much infected. That's why we have some that are lost already, and some that are severely damaged. Then on this one, you could see a very severe, deep cavity. Okay, if so that's
what we have here. This hole.
Yeah, this hole. So that's a cavity, is a carious part. And if this place is not filled, of course, with this you could understand that the pulp is already exposed. Right. So some people, when they have this kind of cavity, they'll begin to gargle some concussions and all that will even worsen the overall health of the person. Okay. So at this stage, it could be filled. Root canal therapy could be done by a dentist to
fill it
up. Yes, to conserve.
So what about the lower part? That's image there.
Yeah, that's a very severe caries, a calculus. You could see a calculus deposit on the teeth. So the gum is already inflamed. So when you remove the calculus, this tooth might be immobile.
So here looks like pus or something eating into the gum.
Yes, there's a gum disease there. There's a gingivitis. They're caused by the irritation of the calculus. The calculus. These are the calculus deposits.
What leads to calculus? This food debris or something?
There are so many things that could cause it, like bacteria. Okay. And refined carbohydrate deposits on the tooth surface. Could attract the bacteria. The bacteria will be acting on those sweetened debris left in the mouth. Right. And then begin to accumulate more and all that.
All right, so let's move to the next slide. So these are essentially the causes of the tooth loss that we saw in the previous slide. Yes, periodontal diseases. Maybe you speak a bit more about that.
It's the inflammation of the gum. Simply put, the inflammation of the gum. Okay. Caused by a bacteria.
But it says that there is over 6 billion bacteria in the mouth.
Yes.
A good number of, in fact, majority of them are normal flora.
They are normal
They don't cause problem.
Yes.
Right? And over 700 species. So what could make the gum get infected when the bacteria are there and not causing any problem? What are those things that could make it cause problem?
Immune system is weak, the bacteria could take advantage of the weakness of the immune system and then begin to harm the body. Right. That's why we usually tell people to monitor what they eat and all that. So the immunity.
And of course, one of those key bacteria is the Porphyromonas gingivalis.
Yes, sir.
Yes. Okay, so we've talked about the cavities.
Yes, and all that. The trauma could be road traffic accident or avulsion, maybe a knock. Somebody can blow off someone's tooth, maybe during
combat sports or
fighting and all that. So, or someone can hit his domestic accident could also actually cause it to. Someone will hit his teeth on a wall or something, and it might fall off. It might break.
Also get damaged. What about those that use their teeth to open cork of a bottle?
That's the worst, actually. Could also cause a trauma on the tooth. So if it is not well treated, the tooth could be lost.
Yes, okay. So there are also genetic and congenital conditions like hypodontia.
Yeah, hypodontia and the rest of them. So there are some people whose saliva, because saliva is the natural cleanser. So when the saliva is not there to always do the prophylaxis needed, wash the teeth. And sometimes when you chew on
is there a genetic situation?
Yes.
What is it called?
It's a genetic condition, actually. And so it could cause the mouth to be very, very bad hygienically, and then because the saliva is not frequently coming to flush the food debris in the mouth. So you could see maybe
it could cause a challenge. So also is it amelogenesis imperfecta?
That one has to do with
Klinefelter syndrome.
Those ones could be during the formation of the tooth pulp and the rest of them.
So those major categories. What is this speaking to?
So the conditions that may lead to tooth loss, like you see the calculus, you could see the extent, all these deposits. This, you could see caries here as well. So these teeth are not healthy. Do you understand it? Because this bacterial deposit has already weakened the gum.
Right.
And the gum is keeping the teeth in place. So when the gum that is holding the teeth firm is compromised,
Okay.
the tooth could be mobile, could cause pain, and for there could fall off on its own, or extraction could take place.
Okay, all right. So we've spoken significantly on a number of causes, and these are some of the habits. Yeah, so we're going to continue this conversation, but let's just take a breather and we'll be right back. You stay with us. Welcome back to the program. So let's quickly go to the risk factors or habits that may lead to tooth losses. We've spoken a bit more about them. So, okay, let's roll from here. Tobacco smoking, how does it lead to tooth losses?
Yeah, tobacco smoking could weaken the tooth. When you see someone who smokes, you look at the tooth, it's compromised. It's very dirty and very weakened. So it weakens the enamel and all that. Then when we talk about consumption of sugar-sweetened beverages,
right,
especially at night, those bacteria, they function more at night.
Okay,
That's
when someone is, maybe someone takes sweet or any
tea,
of the
bread, lollipop, biscuits.
without brushing. Is that why you say people should brush
That's
at night
why we
before
said
going to bed?
to avoid all these things, even if you take them, brush last before you sleep.
Okay.
So when you brush, after everything you have to do for the day, you sleep. When you wake up in the morning, by brushing, you've removed all those remnants
Debris.
of the debris remaining in the mouth. So that the mouth will be free from the bacterial activities while you are sleeping.
Right.
So use of tooth to open bottles and all that.
One day, the bottle, the cork,
We'll
take
pull
out
off,
the
just
tooth.
sometimes we see vertical fracture.
Wow.
From the crown, from the crown,
So it can break.
break it
teeth?
vertically from the crown to the root.
Wow.
Can break it off, and
That's really
in
serious.
such a situation, I think most of the times is removal.
So let me emphasize this. For those of you who are this bad habit of using your tooth to open cork bottles, you could just break your teeth and even take it out completely. You know, that's what Victor Gare, registered dental technologist, has just told us. Of course, poor oral hygiene, we talked about that. Poorly managed diabetes mellitus, perhaps the sugar in the bloodstream,
Yes.
you know, the bacteria could get to fit on it.
Yes.
So, okay, so for these tooth that have been removed, or teeth that got removed, how do we replace them? What are the options?
Wow, there are very many options that we could use to replace those lost teeth, but people don't know about it, and that's why we are here to tell people that there is a hope.
Yes.
Whatever may have taken away your tooth, you shouldn't lose hope.
Okay, so I can see dental implants.
Yes, we have dental implants,
supported bridge,
yes,
removable dentures. Okay, so let's
have
go
so
through
many
the slides.
of them, and on daily basis, new technologies come up.
Okay.
So that if you are not comfortable with one,
you could use the other.
You could use the other.
So next slide, please. Let's see some of those methods. So.
Okay, yeah, this is an implant. This is an implant, and you know what implant means. We are replacing the roots of the tooth with a screw. So this screw will be embedded in the alveolar bone and allows to heal. When it heals, you can now fix a tooth, the crown, the anatomical crown, on that root, on that screw that is already married to the alveolar bone.
Okay, so the alveolar bone, is this the bone?
Yes, that's the bone.
So this is the screw. What is it made of? Doesn't the body react to it?
It doesn't. It's made in such a way that even the saliva or the body is very, very compactable with the human tissue. So it doesn't have any effect. And it could be a lifetime restoration.
Right. So what about the tooth? Is it human tooth? Sometimes people allege, is wrong anyway, that perhaps they take teeth of dead people from the morgue to you. Is that true?
That's a very terrible impression.
So what do you use instead?
Yes, we have, in a very simplest way, we have a plastic one.
Okay.
And we have a metallic one.
Okay.
Then we also have the ceramic one. So a plastic, where you put in the fire, it burns. Human tooth can't burn. It's a bone substance, kind of. The hardest substance in the body. So ceramic, just like the ceramic plate we see, it can crack when it falls from your hand.
Right.
It could break. A human tooth cannot break like that when it falls because it's a bone. Then the metallic one, in those days, we usually use metal.
You know, our time is very fast.
We have gold, we have silver, we have diamonds that could be used to form
all these things.
All this tooth. So it's not a dead body's teeth that we use because we make it to look like the natural. We call it the false teeth. People think we go to the morgue to get this.
Okay, so it's not true that anybody it's
terribly
made of
bad.
metals and all of that. Removable dentures and all of that.
Yeah, we have removable dentures and we have removable partial dentures. The one that 1 or 2 or 3 or 4 teeth are lost.
Okay, like this one.
Like this one, yes, you could see about.
So this looks like hypodontia kind of thing, or maybe anyway.
There is a challenge here.
Okay.
There is a challenge here. You could see the socket. So the tooth was removed.
Okay.
It could be an accident or infection or something. So these are the teeth are removed and you could see where it has been replaced.
Okay.
So we do it in such a way that even your
closest person... I can see this color and that of the natural gum.
Forget about this picture. when my team, when we prepare a denture for you,
right.
Even the closest person to you.
Not for me anymore. I'm not going to lose my tooth very soon.
Yeah. So when we prepare a denture for someone, the closest person to the person can never find out, can never even differentiate the natural one from the one that we fix. So this is a removable partial denture fixed here. And there are some cases where the whole of the teeth are gone. Entirely gone. Some people grow from the age 1 to the high to 60, 100 without a single tooth in the mouth.
That's the case of endodontia, right? Okay, where there is no
dentulous.
Purely let's move to the next slide. You know, we have to be very fast now.
Okay, so people who are using dentures, you know, some people still believe that denture could cause this, could cause that, have side effects and all that. That's why we are saying this, that when you are using a denture, it's very important you maintain the denture. Denture has a maintenance. If you don't maintain it, just like as a calculus, accumulation on the natural one could be on the denture, which could cause infection, could cause gingivitis, could cause other infections. So it's very important we maintain our dentures. We wash them daily, we clean them, and if there is any reason why you don't want to use your denture, you shouldn't just drop it anywhere.
Okay.
Let it be in a clean cup with water.
Okay.
So we should maintain our denture so that infection
do
not
that maintenance, do you bring it out or is still inside too when you
yes,
try
that's
to
why we call it removable denture. So you can remove it
bring
yourself,
it out, clean
it off, because there are some places that your brush could not penetrate.
Okay.
Because food particles will hang in
there. And
so you have to remove it yourself, wash it and fix back.
Okay. Victor, 3 minutes to run through. So what are the potential complications of these procedures you just talked about? You just run through them.
Most of these
procedures,
most of these procedures doesn't have side effect like as some people think. But an ill-fitted denture could cause a stomatitis, oral stomatitis, could cause sore injury in the mouth. For implants, there could be an infection. Do you understand?
Right.
And there could be some hygienic measures that should be put in place and some instructions, because this has to do with surgery, the implant.
All right. So let's get to the next slide. Effects of not replacing them. I think I'll just run through this. Lack of confidence. That's very common. I mentioned it at the beginning. Speech disorders, right?
Inability to masticate effectively and efficiently.
And by mastication is chewing, right?
Chewing. You know. We need to chew the food to an extent that the body could digest it.
Right.
High risk of losing more teeth, gum disease. There could be bruxism when you want to close your teeth. Because there is a drifting already, a shifting, that's normal. When you lose a tooth and you fail to replace it, the one that is close to the one you lost will want to replace the one that is gone.
Okay, so let me go back to the slide, please. I just need to make an important point.
Okay.
So these gum diseases, that bacteria, Victor, you may need to come closer. You're walking away from the screen.
Okay.
The heart disease, there is a relationship between oral hygiene. I think I should stress this fact. There's a relationship between oral hygiene as well as some conditions in the body. Some of the bacteria you allow to accumulate can actually cause gingivitis, get to the bloodstream, and even get to the heart and cause what we call infective endocarditis. Okay, correct. So there's a lot of, so that's why when someone has infective endocarditis, which is an infective condition of the heart, they tend to ask questions around oral hygiene, as well as research have shown that Alzheimer's disease, which is a degenerative mental health condition, and even rheumatoid arthritis and some kind of cancer have been related. Okay, let's move to the next slide. So we really need to round up now, Victor, because we don't have a lot of time. So these are the effects and how to prevent. There's a slide I want us to quickly speak about on any other oral health hygiene tips you need to give so that we can end with that. Yeah,
the first and the most important is the one you do by yourself. You brush very well. We have the right technique of brushing. Some people brush as if they are fighting with their teeth. And when they remember they have not brushed, they tend to rush it and begin to fight and all that.
Right.
Then the brush you are using to brush matters a lot. Some people use hard brush that at the end, it's just the teeth they want to clean. Instead of cleaning the debris, they will end up cleaning the enamel off.
So are you discouraging people from using the hard brush?
Hard brush, yes. You use medium toothbrush. Okay. And change every 3 months.
So not too soft, not too hard.
Not too hard, medium. So then you brush twice in a day, last thing in the night before you get to bed.
Okay.
Then after eating in the morning,
right,
you brush before you take your breakfast and go for your job.
Some of your colleagues said if you brush at night before you sleep, it's better to brush in the morning after the breakfast.
Yes, that's the best thing.
Okay, so that when you brush at night, it's clean. After the breakfast, you also clean up.
Clean up.
Clean
up
go
those
for the day,
before you
so
go
that
for the day. So
every time there wouldn't be much things.
Nothing for the bacteria to attack or to live with.
Okay.
Do you understand? Yeah.
I think it's been a very engaging conversation. We wish there is much more time, but so thank you very much.
Thank you.
Mr. Victor Oge, registered dental technologist, oral health advocate, and all of that. Thanks for the work you do in various communities towards promoting oral health hygiene.
Thank you very much. I appreciate your works.
You're welcome. Yes, I've had a very engaging conversation with Victor Oge, and I believe you must have learned one or two things. Oral health is very important. Builds your confidence, helps to protect you from some other health conditions. Note that there are a lot of bacteria in the mouth. Most of them are normal, but sometimes some of them go crazy, and like Victor told us, when the immunity is very weak, that they can no longer protect, some of those normal flora get activated and begin to cause problem. And also when you take sugary substances at night and you don't brush before going to bed, it can be a heaven, because bacteria, they like sugar a lot and they feed on it. So thank you for watching. My name is Dr. Laz. See you same station, same time next week. Bye for now.